Brad, good to have you here in 160 Studios today.
Oh, thanks, Joe. Appreciate it.
Gary's joining us from Columbus, Ohio. Dr. Gary Ansel. Gary, thanks for joining us.
Hey, my pleasure. Good to be here.
Good to be here.
Good to see you, Gary.
Brad, I was fascinated when I heard about Covellus, and I had not heard the word modularity sort of introduced when I think of a catheter before.
Right.
You know, catheter design hasn't changed much in 40 years, so to speak. And for our viewers, would you explain what the principles of modularity are and how Covellus addresses that and actually potentially created the market?
Sure. So you're right. So conventionally, catheters have been designed as a unitary assembly, like a one-piece construction. And it occurred to me that could be some really interesting advantages if you took a two-module approach at the distal end of the catheter, where really the interesting things are happening, right? That's where all the activity is inside the body. So then it came to, how can you do that easily? How can you add, the physician add two modules together to create something that's going to function in a way that they're familiar with, like a conventional catheter, but introduce all these advantages that modularity brings.
And as a clinician, Gary, when you think of modularity, when you originally thought about it, was it a questionable approach? And now that you've put it in your hand and been part of this evolution, what are the things as a clinician you think about?
Well, it's funny because I was assistant medical chief for vascular for 13 hospitals. And one of the big pain points for me all the time was shelf space, shelf space. How do I get all these products in? Because there's always these new iterations. And, it was a really big problem. We were actually moving the products out of where we use them. So there was always these time delays and things like that. So modularity came up. I immediately thought about a screwdriver with a screw tip, and then Phillips straight, all these different ratchets, all those. And I thought, those are all small packages. I wonder if this will also lead to us being able to get our equipment back in the room. And so I was immediately interested. So I think it's a really interesting concept, and I'm excited about watching where it goes.
And when I think about, Brad, when I think about modularity, I oftentimes think about, I go to two ends. I go, is there a compromise in performance? Or does it offer a variety of other solutions in the hands of the clinician in a more rapid fashion? So how would you address that?
Right. So I think of it in terms of the latter, right? That's actually the way I conceptualized it. It's a way for physicians like Gary to customize their equipment, like as it's happening, as things are unfolding, and so I see it that. So it's more rapid adjustments or modifications they make to their equipment, and it's interesting. Gary thinks about it in terms of the number of devices he has. I think of it in terms of, here's how it can design new product solutions. Everybody's going to have a different take on like where they see this going, but obviously we have different viewpoints.
Am I able to take a series? So if I think about classic in a cath lab, let's use a cath lab. I've got a multiple SKUs sitting right there on the table that I have, or I've got to have somebody run out of the room to get one if something's not in there. Right? And we all know what time in a cath lab means. I mean, I've heard upwards of $100 a minute at times. So do I actually expand my possibility with a modular system because I can sort of cross-reference distal, proximal, and even compound the distal end with multiple tools?
Yes. So the first embodiment or the first design is really looking at PTA balloon catheters as the backbone of this system, right? They're already the backbone of many types of catheter products. So you can think of that like, I'm going to take my basic PTA balloon catheter, and then I can add these different performance features to it. Some that can be very simple ways to modify it, and some could be more complicated. But then, yes, then you're using like a common base module, and you're adding things to it to make it for the physician to customize it.
And Gary, so you've worked with the system before. You've been part of the development of it. From a clinician perspective, what would you share with your peers?
So instead of thinking it totally as modularity, I like the idea that this is an adapter to our base balloon, which is the cornerstone for what we do. And I remember back when we were taping cases and when we were editing them, I was taking out the time that somebody is running to go get the equipment. And I thought, really, when we're in there doing procedures, we're not only weighing what am I doing next, it's, well, if I want to do this next, and that might be optimal, how much longer is this procedure going to take? So sometimes you don't do things because it's going to prolong the procedure. And for us, a procedure length means several things. One, there's always been research that has shown the longer the procedure, the higher the complication rate. That's bad. The other thing is, like you said, time is money. We've got to get efficient. And in fact, many of the procedures are moving out of the hospital to office-based labs and ambulatory surge centers. And the reason they're coming out is because time is king. I just was at one the other day where they did 9 or 10 cases in the day. At most hospitals, you can't pull that off because it's just too much downtime. And then there's always well, I told them to go get this. Will they bring back the right thing? And I think these adapters can be kept in the room much more easily. And I can turn around and go, yeah, that one. And then you have to remember these base equipments are the same length as my balloon catheter. They're 4 or 5 feet, 6 feet long, but the adapters are very short. So I can really rapidly change my base cornerstone therapy to optimize the procedure and do it in a time efficient manner. There's just a lot of win-wins here.
Mm. And I want to cut to the device here so our viewers can get a sense of exactly what we're talking about. But before I do that, Gary, I know one of the things that's a barrier to entry and adoption in med tech and health tech is, how will this change my workflow, and will it change my workflow? I've got a workflow as a clinician, my team's got it down. So does this impact it? Is there a retrain here? Take us down that road.
Yeah, you're singing my song, because I always tell people, if it's not easier, it's almost dead. This is easier. I can much more rapidly make a decision to use an adapter, a cutting balloon adapter, a better tip adapter, a chronic total occlusion tip, all those kind of things. I can have them readily available at my fingertips, and I can have them on the table without taking a lot of space. So it hits or checks that box of, is it easier and can it improve my workflow? I really think this concept does.
Well, let's jump and have a look at the device, and Brad, if you can take it. Visuals help with me. I'm a little slow, so let's go to the tape and see what the visuals look like. Explain to me where the secret sauce is in this modularity.
Right. So as Gary and I were discussing, this is the base parent balloon, right? Catheter, right? And that's going to be common. Everybody's going to understand what that is. It's not really any different. But the idea is you can take these smaller adapters, right? And there's a unique way to couple the two things together so that it's one way, it's secure, it's reliable, it's robust, and it's not going to come apart. And now you've added a feature. In this case, it's a very simple feature. You've just added a secondary lumen so that now the doctor, the physician, can use 2 wires at the same time. One is through this rapid exchange, kind of using rapid exchange techniques, but you still maintain the central lumen. And and I think this is an easy, simple example, but you can, once you start thinking differently about how to incorporate this type of modular approach, it really brings you to you start adding more complicated features, more sophisticated features, really taking the design approach in new and different ways to add a lot of value. And we can get into the modular economies, but I think the pathway for bringing it from this kind of concept to actually a sales opportunity, it's dramatically more efficient. It's cheaper, faster.
So Gary, when you see this device, what immediately comes to mind as a clinician? The customization of things, you being able to expand your skills. What comes to mind when you see this?
Well, I see it as multiple applications for that adapter. So now I can take a balloon catheter that has one usage, inflate a balloon. Now I can add an adapter to it and which could be multiple, and I could add a imaging section to it. I could use a scoring section to it. I could use a blood clot removal section to it. Could use a catheter tip section to it, which would decrease the number of times I have to take a device in and out of the body. And that we have to do with radiation. So there's always that radiation exposure during that time. There's time. I mean, I've got to, work with an assistant, and we've got to back the early device out when it's a standalone just balloon. I've got to back that out and then put the next device in. And then I've got to go back to my balloon and then put the next device in. So there's a lot of steps to doing these percutaneous procedures that these adapters can cut down the number of steps and make it from a single use device to a multiple use device. Multiple different aspects of that can be done at the same time. For instance, oftentimes there's calcification in these blood vessels that is very hard to open or dilate. And the regular balloon just can't get that one or two little areas. And we've got to back that balloon out, take a high pressure scoring balloon in, then we bring the other balloon back. Where if we just add a high pressure short balloon to the tip of this, I can do it all. I can go in, I do my dilation, I figure out where it's not going to work very well, and I just bring that catheter with that little high pressure segment back to that area, and now I inflate there. So I can do multiple things with one entry into the body. And for me, that's time efficient. It's pleasing because, I'm being more successful. It's simpler. So I think there's a lot of good aspects here.
And so the great additions by Gary on the clinical side. But now when we're talking about cost, we're talking about, instead of having 17 of these sitting on the floor somewhere, right? Now my rapid exchange is really at the distal tip, where I'm applying the therapy to the patient, where the rest of it really is just the rails that's being delivered on.
That's right, yeah. And then you can use the same backbone, the same base module for all of those adapters, for anything, right? So now you're adapting it. It's like kind of to Gary's point. So instead of, you're basically adapting your equipment for what's happening during the procedure. So instead of exchanging a guide wire, I'm just going to downsize my catheter, so I'm using a smaller guide wire. I mean, those are the types of embodiments we're thinking of.
And it feels like Gary is a clinician and an artist, right, and a technician. It helps you stay in the flow better too, right? Otherwise, you're waiting for an exchange, you're waiting for another device, you're waiting for a team member to hand you something. It almost feels like this is a lot more staying in the flow of a procedure.
Yeah, I'm not watching paint dry during those procedures. When you're not doing anything, as a surgeon or interventionalist, you're just, you're not used to standing with your hands, not doing anything, just waiting for things. You really want to get things in a flow to that procedure. That keeps your assistant in the flow as well. The room keeps flowing. I mean, you're much more efficient. Like you pointed out, time efficient. So it's a cost-effective procedure, or more cost-effective. And we've got to get to that.
So where did this idea come up? Did this strike you one day? What's your background relative to catheter development, engineering, creativity?
So my background is mechanical engineering, and I actually started in aerospace. I started in a completely different, lane, and I moved. Actually, at the time, I moved through a few different industries. It was like there was a lot of opportunity for the skill set I had, but I was fortunate to end up at a startup company. Actually, a couple different startup companies around the 2005 timeframe. And once I got involved in this type of device development, I mean, it really struck a chord with me. It's like, this is something that I could really be passionate about. But I feel like I also brought all these other experiences to it, and I don't know, I found the medical device industry can be a little bit siloed off. So I think bringing, these other different aspects allowed me to maybe think a little bit differently and to come up with this. But I was at a point where I was trying to figure out what were my next step, what I was going to do. I had an exit, and like, what am I going to do next? And I thought of this way to customize. The idea was, how can I customize the equipment for physicians? How can they do that? And it kind of snowballed from there. And it started small, started very simple, but then the idea really grew. And then as I started talking to Gary and some other people, you know, because they're bringing different viewpoints. I think Gary looks at it very differently than I do, but that's the beauty of this. I think it's, you know, everybody's going to be able to like figure out, here's how I could take this type of technology, this type of design idea, and really create value for my practice.
And I can guarantee you that some VP of R&D or chief technology officers watching this right now and is going to run down the hall to their biz dev guy and say, we need to do something like this. So is your IP solid on this?
Super solid.
Okay,
this,
just
yeah.
making sure,
It
because
is.
I know somebody's going to be looking at this going, how come we didn't think this up? And why did you start at the balloon? What was the impetus for a balloon?
Well, partly because you know, I've known Gary for a while now. I was involved in a peripheral vascular catheter device company with Gary. He was one of he was our primary advisor, and you know, that's where most of my catheter design experience has been. So naturally, that's where I gravitate towards. And I think, you know, if you start contemplating the design of PTA balloons, because of the nature of, you know, in order for it to be a viable product, you might need dozens or hundreds of variant SKUs, balloon diameters, lengths, catheter lengths. So you know, that it just kind of lends itself to being the base in a modular system.
Got it. Gary, do you think that this modularity has legs? You mentioned cost, access, and outcomes earlier. Modularity impact cost and improves outcomes, in your opinion, if it's used in the proper setting?
Right. I think it makes your procedure more thoughty. I think that instead of thinking about time, you're thinking about, hey, what's the next best step for this procedure? It makes it, again, efficient, which is what we want, because we want procedure lengths to be as short as possible. We're continuing to work to be less and less invasive, and this is what that works at. There's also, we talked about the cost of healthcare. I mean, the designing of every one of these elements as a standalone device has just gotten almost cost prohibitive, where, as Brad has been explaining with his interactions with the FDA, Food and Drug Administration, that there's a simpler pathway because you can utilize the base angioplasty balloon approval as part of the approval process that's already there. So now you're just adapting to that, and it's a little bit shorter process. I also think that instead of having, like, a company will have a chronic total occlusion catheter, they don't usually have two. Why? Because it costs too much to develop. Well, they all don't act the same. That's why we buy a whole bunch of them. But for these tips, we could say, hey, what's the best tip for this procedure? Just grab that, put it on this balloon. So it makes the procedure kind of just smoother, faster, more efficient. And that's where we have to get. That's what the basis of being less invasive is all about. So I think it does have legs.
And as I listen to you and I listen to Brad, it almost feels too that you could end up as a clinician with an aggregation of tips, even get a more precise as to what your skills are or are not relative to a procedure.
Oh, absolutely.
Yeah.
You know, I was the assistant medical chief for all the different hospitals. I mean, that was everything from a quaternary, you know, referral hospital down to an entry-level community hospitals. And the skill sets and the needs are different in those different hospitals. So like you said, I could, if I was still chief, I'd be able to more individualize what devices are stocked at what institution to really maximize the skill set and the success rate for those different physicians.
Yeah, and as we get into the data analytics world in business and in health tech, you can also start to have a predictive analytics for the hospital and inventory. You mentioned ASCs, is the old Pareto rule, right? 80% of our procedures are done with 20%, right? But then if I don't have that 20% and I need it in that event, it's a lot easier for me to inventory a tip. A distal, you know, tip that's applying the therapy than having these 6-foot-long Tyvek packages sitting in a storage closet somewhere.
Right. Or you may not even have the right one you need, right? That's the beauty of this type of system. You're always going to have the right size balloon with the right size features you're adding to it, right?
It's fascinating.
Yeah.
Well, listen, I'm glad somebody's brought modularity up at a core base on a catheter. Is there anything we didn't talk about today that we should have, Brad?
I mean, there's a lot to unpack, and because I'm seeing it from a design perspective, right? And I'm seeing it. Here's how you could take this type of idea and really create a new category of product solutions, right? And and I can envision, and Gary and I, we talked about, and the other advisors I have, we talked about, these would be the great kinds of more sophisticated features we could add to it. Like, we talked, there's the potential for incorporating advanced imaging, with your therapy, with your device, right? So now it's more real time.
Well, your engineers are getting excited watching this because they get to engineer more new stuff. Because right now, to Gary's point, the engineer's like, listen, we have 3 catheters there already. That's it. And then some engineer's sitting in a room somewhere and she's going, but we could, like, I can't redesign an entire catheter. We don't have the budget. We don't want to go through the FDA process.
Yeah.
But the engineers are like, but what if we just
Did this
distal tip, right?
Well, that's it. And the other way I look at it is it changes the threshold for what is viable, right? If I have to design a completely new catheter, and it's got to have 100 SKUs, and I've got to go through all this process and and a completely new manufacturing line, and I got to inventory these. It's your calculus of like, okay, well, this would be the revenue threshold I need in order to start that project. You might dramatically lower that. It might be very low, right? Where now it's like, and engineers that I like, because I think like an engineer, because I am. If you know that I'm never going to get to that threshold, you won't even start contemplating these designs. Like, it's just never going to happen, right?
Gary?
I think to add to that, one last thing is this will be cheered on by my kids, because the other box it checks is green. I mean, if we're getting these long catheters, all their expensive manufacturing materials, the waste goes way down. Now we're doing a tip instead of a long catheter, and several things decreases. We just decrease waste. We decrease what we put into onto the earth. And we also then decrease the cost of our, waste management. I mean, medical waste is really, I put my administrator hat on. I mean, medical waste is really expensive, and all these things they're single-use items right now. And, that is probably not going to go away, at least in my lifetime. And so we can really decrease our footprint with these types of devices. And I think that checks a box our future generations are really going to like.
And so I would agree with you on that. I'll take you out with this really green, conscientious, capitalistic mindset. I recently read that if healthcare were a country, it would be the 5th largest emitter of greenhouse gases on the planet. So, I don't think there's going to be a holy grail, but I think we could chip away at it, and this certainly has another benefit to it. So, well, Gary, thanks for taking time out this morning from Columbus. Certainly appreciate it, your perspective on things. And Brad, congratulations. Mind-bending approach here that's so simple. Wishing you well on this one.
Thanks so much, Joe. I appreciate it.
You got it.
Take care, Gary.
This is Joe Mullings from 160 Studios. Be well.